thank you for participating in the Wellness Wave brought to you by ACP Southern California Chapter 3. My name is Lena Brady and I'm a medical student at UC San Diego School of Medicine representing ACP Southern California Chapter 3. Today, I'm so honored to be interviewing Dr. Horwitch. Dr. Horwitch, could you please tell our ACP viewers a little bit about yourself and what you do?
Sure. So I'm a primary outpatient care medicine physician. I also spent the past 20 years working with our internal medicine residency program as an associate program director. So I'm very involved in education and teaching. My specialty areas, in addition to just general internal medicine, are care of patients with HIV, which I've done for over 30 years, as well as the LGBTQ community, specifically some transgender care. And I have a special passion for public health, and I've been fortunate to be able to do some teaching and training in other countries as well.
What other countries did you train in?
Several countries in Africa, Zambia, Namibia, Botswana, Ethiopia, Nigeria.
Mm-hmm. Well, thank you so much for sharing that. And it's amazing to see how broad your career is spanning, teaching, public health, global health. So could you tell our viewers a little bit about how you chose your career path in medicine?
Sure. When I was in medical school and then doing all of my rotations, one of my mentors really wanted me to go into surgery, which I loved because I like doing procedures, but I really felt a connection to internal medicine because I really love the relationships that you can have with patients, that you can follow them over the breadth of their life or their illness, either one. And I like the opportunity to be able to be a clinician educator for that. And I like dealing and working with adults as opposed to pediatrics. So that's how I ended up in internal medicine.
Mm-hmm. Thank you for sharing that. And for all of us who haven't figured out our career paths yet, what advice do you have for us?
My main advice is this: follow your passion and follow where your heart is leading you when you start doing your rotations. And if something seems to fit, think about that. Think about what that might mean for your career, what sort of lifestyle you may want to have, what opportunities you may want in the future. I realize it's very hard to know, well, where will I be in 5 years? I've never liked that question. I have no idea where I'm going to be in 5 years, nor have I said that for any time in my career. But follow your heart. And I knew when I was doing different rotations, which things felt right for me and what was not going to work in terms of what my passions and my interests were.
Mm-hmm. Yeah, that's great advice. And I'll definitely follow it for me personally.
Now, of course, I always hope that everybody chooses internal medicine because I think it offers such a breadth of opportunity. And you can go in so many different directions: general, hospital, specialty, public health. So I think it kind of has it all.
Yeah.
But if you want to be a surgeon or something else, go for it. We need more people in medicine in general.
Mm-hmm. Yeah, and sort of going off of that, I wanted to ask, since you've winded your career to encompass both clinical work and public health work, how's your experience with public health informed your clinical work and vice versa?
I started my very first job. I actually did my public health degree prior to doing medicine. So I already came into medicine sort of having a community health, public health ideology. And my first jobs actually would be what would be considered in the public health arena. So I worked in the STD clinics in different places. I worked in the jail for jail health, which is actually under the auspices of public health. And I think through that, it really gives you a sense of the community and the communities where our patients come from. A lot more than just going into a clinic or just a hospital where you really only see them not at their best and not in their own community and sometimes separated for that. I also believe that doing a lot of the advocacy work, it really fits in with the social determinants of health, and most of those are public health. So really, medicine and public health, I think, should be in a marriage, not in a silo.
Yeah, I totally agree with that. And I really appreciate how you mention it's so important to actually see the community members in their spaces, in their community, not just in the clinical space. It's really quite different. So thank you for sharing that. And my last question for you is, from your past experiences as a medical student and a resident, your current experiences as a teacher, since you have so much experience in education, what are some skills we can build to remain well and happy during our training?
Sure. So first of all, I think, again, and this was something I never learned in medicine, so we didn't really pay a lot of attention to wellness when I was a student or a resident. But through that, perhaps trying times, and I do not ever recommend we go back to them, I learned a little bit about some skills that are necessary, I think, to stay well and whole. One of them is boundaries, and making sure that you know what's important for you, that keeps you well and whole. If that means getting home to have dinner with your family by XYZ time, with maybe a few exceptions, then that's important to really make sure that where you go for training and where you might work after that respects that and allows people to be flexible. I also believe that there's a huge part of wellness that is about learning some resiliency techniques. Even though that is not the biggest thing for staying well, it is extremely important. Medical school and residency in particular are very hard times in our lives. They're stressful. There's a lot of expectation. It's a huge learning curve, and we are learning all the time. But I think it's really important to laugh, and I teach laughter. I think it's really important to smile a lot, to remember kindness and gratitude. And I think we need to sometimes share that kindness and gratitude with ourselves. We tend as physicians, we're always outwardly sharing that with our patients, but we don't always treat ourselves with the same kindness and respect and compassion for which we are actually in our profession. So I think we need to treat each other that way in our profession, as well as our patients, but also for ourselves and our family. So those are just a few things that I try to practice every day to maintain my wellness.
That was wonderfully said. Thank you so much, Dr. Horwitch, for sharing your knowledge and your great experience with us. I'm sure our viewers will most definitely benefit from the advice you shared.
Thank you. Can I just share one more little tidbit of recommendation to the viewers?
Of course,
I think
go ahead.
for those who might want to read a very easy book that kind of talks about, and I found this book really revolutionary for me, is just learning about how our brain works and some things we can do. Number one, to make us learn better, but also to know what our brains really can and can't do so that we're paying attention to keeping them healthy. It's called Brain Rules. Can you all see that?
It's a little blurry.
Little blurry. Anyway, it's called Brain Rules. The author is John Medina, and I would suggest it. You might suggest it to your program directors or your medical school, perhaps, to buy it for everybody, because I think it's a really well done book that will help us at any time in our lives.
Yeah, thank you so much for sharing that book recommendation with us. I'm sure we'll look into it.